Hello and welcome. I'm so glad you're here. If you're watching this, it probably means you or someone you love is facing a healthcare decision, maybe an upcoming surgery, a new diagnosis, or simply trying to find the right doctor. And if you're feeling a little overwhelmed by it all, that's completely normal. Healthcare can feel complicated, even intimidating. But here's what I want you to know right from the start: you have more power than you think. Today, we're going to talk about something really important: preparation. Specifically, how to prepare before you ever walk through a hospital door. Because the truth is, the decisions you make now before treatment begins can have a huge impact on your safety and your outcomes. Over the next hour, we're going to cover three essential topics. First, we'll talk about selecting your healthcare provider, understanding who's caring for you, checking their credentials, and asking the right questions. Second, we'll explore researching your hospital, using simple free tools to compare safety ratings and make informed choices about where you receive care. And third, we'll discuss your patient rights, what you're entitled to, how to use those rights to advocate for yourself, and how to make sure your voice is heard. By the end of this module, you'll have practical tools, real questions to ask, and the confidence to take charge of your healthcare journey. Because safe care starts with being informed. And that starts right here, right now. So let's get started. So let's talk about choosing the right healthcare provider. And I want to start by saying something that might surprise you. Not all doctors are the same. Now, I don't mean that to sound harsh or alarming. What I mean is this: just like in any profession, healthcare providers have different levels of training, different amounts of experience, and different communication styles. And those differences, they matter. They can directly affect your outcomes, your safety, and how supported you feel throughout your care. That's why I like to say, trust but verify. It's not about doubting your doctors, it's about being informed. And it's about knowing who's caring for you and feeling confident in that choice. So let's break this down together step by step. First, let's talk about the characteristics that really matter when you're choosing a provider. Communication style. Does your doctor explain things clearly in words you can understand? Do they invite your questions or do you feel rushed? Good communication isn't just nice to have, it's a safety issue. When patients understand their care, mistakes are less likely to happen. Respect and listening. Does your provider take your concerns seriously? When patients feel dismissed, critical warning signs can be missed. Your instincts matter, and a good provider knows that. Experience and track record. Has your doctor done this procedure many times before, or are they still building experience? Outcomes consistently improve when providers perform procedures regularly. We're going to talk more about this in just a moment because it's one of the most important questions you can ask. Collaboration. Does your provider work well with nurses, specialists, and the rest of the care team? Healthcare is a team sport, and the best outcomes happen when everyone communicates well. Transparency and honesty. Is your doctor willing to talk openly about risks, complications, and alternative options? That builds trust and helps you make truly informed decisions. And finally, comfort. Do you feel at ease with this person? Trusting your provider lowers anxiety and makes it easier to speak up when something doesn't feel right. And speaking up can save your life. Now let's talk about the different types of healthcare providers you might encounter, because understanding who's who can help you know what to expect. Attending physicians are fully licensed, board certified doctors who have completed all their training. They're experienced and they have the final responsibility for your care. If you're at a teaching hospital, attending physicians supervise residents and make sure everything meets the right standards. Medical residents, on the other hand, are doctors who've graduated from medical school but are still completing their specialized training. They work under the supervision of attending physicians and are gaining hands on experience. They make many day to day decisions, but the big, complex calls are reviewed by the attending. It's important to know if residents will be involved in your care, and that's something that you can and should ask about. Medical doctors, or MDs, and doctors of osteopathy, or DOs, are both fully licensed physicians. MDs have traditional medical training, while DOs receive additional training in something called osteopathic manipulative treatment, which focuses on the whole body and musculoskeletal care. Both can diagnose, treat, prescribe, and perform surgery. Then there are advanced practice providers like physician's assistants and nurse practitioners. These professionals can provide excellent care, but their training and scope of practice are different from physicians. Physician's assistants, or PAs, work under a physician's supervision. They can diagnose, prescribe medications, and perform certain procedures depending on state laws. Nurse practitioners, or NPs, have more variation depending on the state. In some states, they can practice independently. In others, they need physician oversight. And here's something really important to know: NP training can vary a lot. Some programs require only 500 clinical hours, while others require over 1,000. Some programs are mostly online, while others have several years of hands on experience. If an NP is going to be managing your care, it's completely reasonable to ask about their training and experience, especially for complex conditions. Understanding these roles isn't about judging anyone's qualifications. It's about knowing who's making decisions about your care so you can ask informed questions and feel confident. All right, now that we know who might be caring for you, let's talk about how to research them. And I promise this is easier than it sounds. We've created a free guide for you. It's called the Physician Research Platform, and it walks you through exactly where to go and what to look for. But let me give you the highlights. First, check your state medical board's website. This will show you if your doctor is licensed, if their license is current, and if there have been any disciplinary actions against them. Visit the American Board of Medical Specialties website to confirm your doctor is board certified. Board certification means they've completed specialized training and passed rigorous exams in their field. It's a mark of expertise. Third, look at the Federation of State Medical Boards to check for any disciplinary actions or licensing issues across multiple states. And if you're looking for a surgeon, we've also included a link to a database where you can search for qualified surgeons in your area. Finally, you can explore online review platforms. Now, take reviews with a grain of salt. One bad review doesn't tell the whole story. But if you see consistent patterns, that's worth paying attention to. The key here is this: verifying credentials builds trust. And when you trust your provider, you're more likely to ask questions, follow treatment plans, and feel confident in your care. Now, I want to talk about something that many people don't think to ask, but it's one of the most important questions you can ever ask a surgeon. Let me ask you this: if you needed surgery, would you feel safer with someone who's done that procedure hundreds of times, or someone who only does it once or twice a year? Most of us would say the same thing: experience matters. And in surgery, that experience can literally mean the difference between life and death. Studies show that surgeons who perform procedures frequently, what we call high volume, have better outcomes. Their complication rates are lower, their patients recover faster, and mortality rates go down. But here's the thing: many surgeons only perform certain high risk procedures a handful of times per year. And unless you ask, you might not know. So here's the question you need to ask: how many of these procedures have you performed in the past year? You also want to ask, what's your complication rate compared to national averages? How many cases like mine do you treat each year? What are your success rates for this condition or procedure? And if you're having surgery at a teaching hospital, ask this too. Will there be residents or medical students involved in my surgery? If so, what will they be doing? And will you still be in the room? These aren't rude questions, they are safety questions. And a good surgeon will respect that and answer honestly. Your safety isn't about luck, it's about informed choices. And this is one of the most powerful questions you can ask. Before we move on, let me say a quick word about second opinions. If you're facing a complex diagnosis, a high risk treatment, or you're just feeling uncertain about your care plan, getting a second opinion is not only okay, it's smart. Most doctors actually welcome it. It confirms their recommendations or it presents alternatives you hadn't considered. Either way, it empowers you to make confident, informed decisions. Start by talking to your current doctor about your concerns. Then identify a qualified specialist in the relevant field and provide them with your medical records. A second opinion brings clarity. And when in doubt, another expert's view can bring real peace of mind. So let's recap what we've covered so far. Choosing the right provider means looking beyond credentials to communication, experience, and collaboration. It means understanding who's on your care team and asking the right questions, especially about surgical experience. And it means verifying qualifications using trusted resources and not being afraid to seek a second opinion when something feels uncertain. These steps build trust, they create safety, and they put you in the driver's seat of your healthcare journey. Now, let's talk about where that care happens and how to choose the safest hospital. Here's something I need you to understand. Where you receive care matters just as much as who provides it. Hospitals vary, sometimes dramatically, in safety, quality, and patient outcomes. And those differences, they can mean life or death. Infection rates, surgical complications, readmission numbers, these aren't just statistics. They're signals of how well a hospital protects its patients. That's why I say know before you go. Now, you might be thinking, how am I supposed to know which hospital is safest? And that's a fair question. But the good news is there are free, easy to use tools that do the heavy lifting for you. Today, I'm going to show you exactly how to use them. But first, I need to talk about something that most people don't know, something that might surprise you. It's why researching your hospital is so critical. Let's talk about patient harm reporting, or rather, the lack of it. You've probably heard the term never events. These are serious, preventable medical errors, things like operating on the wrong body part or leaving a surgical instrument inside a patient. The Centers for Medicare and Medicaid Services, or CMS, can penalize hospitals financially for these events. But here's the catch: hospitals are not required to publicly report them. Then there are sentinel events. The Joint Commission defines these as unexpected events that cause death or serious harm. Hospitals must review them internally, but reporting them is voluntary. That means if a hospital chooses not to report, no one outside the hospital knows it happened. Here's the bottom line: there is no federal mandate requiring hospitals to publicly report serious harms. Only some states have laws that make adverse event data transparent. As a result, much of the most serious patient harm remains hidden from you and your family. So, how are you supposed to make an informed choice if the data isn't public? That's where tools like Leapfrog and CMS Hospital Compare come in. They're not perfect, but they give you a window into hospital safety that you wouldn't otherwise have. Let me show you how to use them. Let's start with the Leapfrog Hospital Safety Grade. Leapfrog is a nonprofit organization that analyzes hospital data for safety and quality. Twice a year, it assigns letter grades A, B, C, D, or F to nearly 3,000 hospitals across the United States based on 32 different safety measures. Think of it like a report card for the hospitals. And just like in school, you want an A or B. You really want to avoid a D or an F. In spring of 2025, only 11 hospitals nationwide received an A grade, while 19 received an F. That should tell you something. Not all hospitals are created equal. Here's how it works. When you go to the Leapfrog website, you can search by zip code to find hospitals near you. Each hospital gets an overall letter grade, and you can click in to see how they perform in specific categories. Leapfrog looks at 5 main categories: infections, things like MRSA, C. diff, surgical site infections, and sepsis after surgery; problems with surgery, like dangerous objects left inside a patient, surgical wounds that split open, or breathing problems after surgery; safety problems, such as dangerous bed sores, patient falls, blood clots, or collapsed lungs; practices to prevent errors, like whether the hospital uses computerized order entry, barcode technology for medications, proper hand washing, and clear communication; and finally, doctors, nurses, and hospital staff, including ICU staffing, communication quality, and whether the staff work together to prevent errors. Each of these categories has multiple individual measures, and each measure is color coded. Green means better than peers, yellow means average, and red means worse. So if you're looking at a hospital's Leapfrog grade, you're not just seeing a single letter, you're seeing exactly where that hospital excels and where it struggles. Now, here's how to use this information. Aim for an A or B when planning elective care, like a scheduled surgery. If a hospital has a D or F, consider alternatives if possible. But, and this is important, if it's an emergency, go to the closest emergency department first. In a true emergency, speed saves lives. Safety starts with getting care fast. Once you know a hospital's weak spots, you can bring that information into your conversations with your care team. For example, let's say you're planning a surgery and you see that the hospital has higher than average rates of blood clots after surgery. You might ask your surgeon, "What steps will you take to prevent me from developing a clot?" Or if infection rates are high, you could say, "I see the hospital's infection rates are higher than average. What precautions will you use to protect me?" Or maybe kidney injury after surgery is flagged as a concern. You might ask, "Leapfrog shows complications like kidney injury after surgery are an issue here. How will you monitor and protect my kidney function during and after the procedure?" Or even something as basic as hand hygiene. Hand hygiene is one of the most important safety measures. Can you explain how your team ensures every provider washes their hands before caring for me? The goal here isn't to confront your care team. It's to show that you're informed, engaged, and expecting safe care. These questions can open the door to more transparent conversations and safer outcomes. Let me give you a quick example. Imagine Sarah is planning hip replacement surgery. She goes to the Leapfrog website and looks up 2 hospitals in her area. Hospital A has a B grade with green marks for infection control and surgical safety. Hospital B has a D grade with several red flags for falls, infections, and communication. Sarah takes this information to her surgeon and expresses her concern for safety and requests to have her surgery performed at Hospital A with better safety performance. That simple step helps Sarah make a safer, more informed choice. Now let's talk about the second tool, CMS Hospital Compare, also called Medicare Compare. The website, run by the Centers for Medicaid and Medicare Services, lets you review hospital performance on safety and quality measures, things like complications, mortality rates, readmissions, and patient experience. Hospitals receive a 1 to 5-star ratings based on 46 quality measures. More stars means better performance. And just like Leapfrog, you can compare hospitals side by side. So, what should you look for? First, check the overall star rating. A hospital with a 1 or 2 stars may have significant issues with quality of care, patient outcomes, or safety. If you have a choice, look for hospitals with 4 or 5 stars. Look at the infection rates. High rates of MRSA, C. diff, or surgical site infections suggest poor infection control practices. Check readmission rates. If a lot of patients are coming back to the hospital shortly after discharge, it might mean the hospital isn't providing adequate care or clear follow up instructions. Look at mortality rates. Higher than expected death rates for conditions like heart attacks, pneumonia, or heart failure can signal problems with the quality of care. Review surgical safety scores. If a patient has poor outcomes for surgical procedures, like high complications or infection rates, it may not be the best choice for surgery. Check staffing levels. Hospitals with low nurse to patient ratios may struggle to provide adequate attention to patients, and that affects safety. Look at patient experience scores. If patients consistently report poor communication, long wait times, or inadequate pain management, that's a red flag. And finally, check for penalties. Medicare penalizes hospitals for poor performance, things like high readmission rates or hospital acquired conditions. If a hospital has been penalized, that's worth noting. Once you have this information, bring it into your conversations. For example, I noticed this hospital has higher than average readmission rates after surgery. What steps will you take to make sure I don't have to come back? The mortality rate for my condition is higher here than at other hospitals. How will you lower my risk? Patient experience scores are below average. How can I be sure communication with me and my family will be clear during my stay? These questions show you're prepared, proactive, and invested in your care. And that encourages your team to prioritize safety and transparency. Before we move on, let me say a quick word about teaching hospitals. Teaching hospitals are affiliated with medical schools, and they often have access to cutting edge technology and specialized expertise. But because they're training grounds for residents and medical students, you may be cared for by providers with varying levels of experience. Now, that's not necessarily bad, but it's important to know. Always ask who will be directly involved in your care and make sure attending physicians are overseeing key decisions. You have the right to know and you have the right to ask. So here's the takeaway. Doing your homework before choosing a hospital isn't about fear. It's about being prepared. By using free tools like Leapfrog and CMS Hospital Compare, and by asking informed questions about hospital differences, you take control of one of the biggest safety decisions you'll ever make. Informed choices lead to safer care and better outcomes. And that's what we're here for. Now let's talk about something that's absolutely foundational to your safety, your patient rights. As a patient, you're not just a recipient of care, you're an active participant. and you have legal and ethical rights that protect your safety, your dignity, and your voice. Knowing these rights helps you ask informed questions, make decisions with confidence, and advocate for the best possible care. When patients and families understand their rights, they move from being silent observers to empowered partners in healthcare. That's why I like to say your rights are your strongest safety net. So let's walk through the most important, actionable rights you need to know and how to use them. First, informed consent. You have the right to a clear explanation of your diagnosis, treatment options, and risks before any care is provided. That includes a complete explanation of the proposed treatment, a discussion of risks and potential complications, alternative options, the consequences of refusing treatment, and time to think about your decision. Here's how you can use this right. You might say, can you explain the risks of this procedure in plain language so I can make an informed decision? Informed consent isn't just a signature on a form, it's a conversation, and you deserve to understand what's happening to your body. Second, the right to refuse treatment. You can decline care even if doctors recommend it, and your decision must be respected. You might say, I understand your recommendation, but I'm not comfortable moving forward with this treatment right now. This is your body, your life, and your choice, and that choice must be honored. Third, access to medical records. You have the right to see and request copies of your health records. You might say, I'd like a copy of today's lab results and notes for my own records, please. Your medical records belong to you. Keeping copies helps you stay informed, get second opinions, and track your care over time. Fourth, the right to a second opinion. You can seek another medical opinion before making major healthcare decisions. You might say, before deciding on surgery, I'd like to get another doctor's perspective. Can you provide a referral? A second opinion can confirm a diagnosis, clarify treatment options, or present alternatives you hadn't considered. It's not an insult to your doctor, it's smart healthcare. Fifth, respect and dignity. You deserve to be treated with compassion, free from discrimination. You might say, I want to make sure my cultural and personal preferences are respected during my care. Can we talk about that? Your identity, your beliefs, and your preferences matter, and they should be honored throughout your care. Sixth, the right to safety. You have the right to receive safe, high quality care in a secure environment. You might say, I've noticed staff aren't always washing their hands before entering the room. Could you please ensure that happens? Speaking up about safety isn't being difficult, it's protecting yourself, and it can prevent serious harm. Seventh, privacy and confidentiality. Your health information must be kept private and shared only with those involved in your care. You might say, can we continue this discussion in a private space? I'd prefer not to talk about my health at the bedside with visitors present. Your privacy matters, and you have the right to control who knows what about your health. These seven rights fall into four main categories: information rights, decision making rights, safety and quality rights, and privacy and dignity rights. Let me break those down quickly. Information rights include the right to understand your diagnosis and treatment, know the risks and alternatives, receive information in your preferred language, and access your medical records. Decision making rights include the right to refuse treatment, participate in treatment decisions, seek second opinions, and have your advance directives or living will respected. Safety and quality rights include the right to safe, quality care, to know your caregiver's names and roles, to voice concerns without fear of retaliation, and to have family or advocates present. And privacy and dignity rights include the right to privacy and confidentiality, respectful treatment, cultural and religious considerations, and clear complaint procedures. Patient rights aren't just policies on paper, they're protections designed to keep you safe. When you know and use your rights, you strengthen your ability to advocate, partner with your care team, and ensure your voice is heard. Rights create the foundation for effective communication and safe, respectful care. They're tools, and like any tool, they work best when you know how to use them. So, to recap, when patients and families know their rights, they don't just receive care, they shape it. These rights are the foundation for speaking up, asking questions, and ensuring safe, respectful care every time. Your rights are your strongest safety net. Use them. All right, we've covered a lot in the last hour, so let's bring it all together. By choosing the right provider, researching your hospital, and knowing your rights, you're taking the first and most important steps towards protecting your health. These decisions create the foundation for safe, effective care. And I want you to hear this clearly. Being informed is not about being difficult, it's about being prepared. Every question you ask, every rating you check, and every right you exercise brings you closer to safer, more confident healthcare experiences. So here's what I want you to do next. I call it your 48-hour action plan. Within the next 2 days, take these 5 steps. 1, research and verify your current providers. Use the tools we talked about, your state medical board, the American Board of Medical Specialists, and online reviews. Make sure you know who's caring for you. 2, compare hospitals using Leapfrog and CMS Hospital Compare. If you have any upcoming procedures, look up the hospital in your area and see how they compare. Write down any questions or concerns. 3, gather your medical records. Request copies of recent lab results, imaging, and doctor's notes. Keep them organized in one place. 4, prepare your question lists. Use the examples we've shared today. Write them down. Bring them to your appointments. Don't be afraid to ask. And 5, identify your healthcare advocate. This is someone you trust, a family member, a friend, a loved one who can speak for you if you're unable to speak for yourself. Talk to them now before you need them. These 5 steps may feel small, but together they can make all the difference in protecting your health. Selecting the right healthcare provider in the hospital isn't just a choice, it's a safety strategy. By checking credentials, looking at hospital ratings, and understanding your patient rights, you set the stage for safer care and better outcomes. Remember, informed patients and families are powerful partners in healthcare. So take the time to ask questions, do your research, and know your rights. You deserve safe, respectful care. And now you have the tools to make sure you get it. Thank you so much for being here today. I'm honored to walk this journey with you. Stay safe, stay informed, and take care of yourself and your loved ones.